Good morning, everybody. I'm hoping you can hear me. So as I'm testing out a new piece of equipment, my usual method didn't work this morning. This week I'm going to talk about dementia, and it was this week's blog all about what was dementia and what were the symptoms and early warning signs, and also about cutting your own risks in terms of dementia. So let me introduce myself. My name is Deborah Byrne, and I am known across social media as DBpsychology, and you can find my blog at www.deborahbyrnepsychologyservices.com. So what is dementia? Most people get confused about dementia as to what it is. They think they get confused between the terms Alzheimer's and dementia, when in fact there is about 100 forms of dementia, of which Alzheimer's is one of them. Now, Alzheimer's and vascular dementia would make up about 90% of the cases. So the other 98 forms of dementia make up only the 10%. They only make up the 10% mark. Dementia is known as neurocognitive disorder. Dementia is the common word, and it's okay because that's the word people are used to, and they are that's the word that we use, and even within the medical community that's the word they would use to describe different forms of dementia. You might hear the term neurocognitive disorder bandied about, but that would be more in terms of somebody within the medical profession. They would use that term, but it's the same thing. It's exactly the same thing. Now, there are, of course, early onset dementia, but for the most part, it's 65 plus is when we see people with the vast majority of cases coming in with dementia symptoms. Early diagnosis is very important, and I'll come to that a bit later on. The symptoms themselves will very much depend on what type of dementia you have. Now, I've listed out the most common forms of dementia. Other than Alzheimer's and vascular dementia, as I said, they make up 90% of the cases. There are other ways in which you can get forms of dementia. So do check those out. They are on the blog, and symptoms will be related to those. They are cognitive and psychological. So what I'm going to talk about this morning is two different things. One is the early symptoms to keep an eye out for. They would be general early symptoms to keep an eye out for. And the other thing is cutting your risks. We all want to cut our risks. I don't think there's been a family that hasn't been affected by some form of dementia. So, we want to cut our risks. So early signs, memory loss. Of course, memory loss. We all know that that's one of the big ones we see people with that or we associate with a form of dementia. Mostly we would think Alzheimer's and memory loss, but any form of dementia, memory loss is going to be the one. Language. People losing words, maybe forgetting a word, or it's the word that's on the tip of your tongue, but you can't quite know what it is. That's another one people are familiar with. They would be the ones that are familiar with. Changes in mood, though, you mightn't realize that people's moods can change. Depression is a big early warning sign for dementia. It's very common, and it would be a very early warning sign. So don't leave it, get it treated, get in there, get it looked at, and see what, if it is an early warning sign. Combined with other signs, don't jump the gun on any of these. Think, what am I getting? Or is my loved one getting a number of these? Trust your gut instinct and go to the doctor early. Confusion is another one, leaving things behind. A lot of the times it will be the keys, the wallet, and then also difficulty in following conversation, or the thread of a television program. If you're watching some sort of television series or that, losing the thread and not remembering what has happened before. Managing money becomes a difficulty. Probably not too early on, but maybe for some people it might be. A sense of direction, places that you've normally gone to, or more so with new places, even though you might have the directions, but you lose your sense of direction. Losing interest in hobbies and interests in general, that'd be more tied in with the depression I was talking about. So if people are starting to lose, you might notice that they're depressed, but you might notice that they've lost an interest in passions that they've had, hobbies that they were really passionate about and they were really interested in doing and they loved doing, and they've now started to lose interest in those. And the other big one, I suppose, that people would associate with dementia is repeating yourself. So the same story over and over again, meeting the person, and you have the same conversation. It's the same thing over and over again. That constant repetitiveness of, wait till I tell you what happened, and they launch into the same story over and over and over again. So all of those the top two there, the top and the bottom one in particular, memory loss and that repetitiveness, are the two that are most, I suppose, most well known for dementia, or some people would associate it with Alzheimer's, but for dementia itself, that is what, they're the ones we look out for in early onset. Now, a few things to think about here. One, there are medical conditions that can mimic dementia. And once the medical condition is treated and cleared up, the symptoms that were mimicking dementia can go away. So never let any of these symptoms go. If you have noticed that there are a few symptoms there, it may not be dementia, it could be a medical condition and it needs to be treated. So off you go to the doctor. Early diagnosis as well is extremely important, and that's multifold. One, you want to get the supports in place if it is dementia. Two, treatment now can help slow down the progress of these diseases. So it's really important that all the supports and all the treatment be put in place as early as possible. And the second thing about diagnosis is, as I said at the start, you can have you could have somebody in their 40s, you could have somebody in their 50s with a form of dementia. And if you look at the list of what I've put up, you'll see, oh yes, that I can see now what you're talking about. So do check those out, and do, never be afraid to go to the GP and say, I've noticed these things. I suppose the biggest problem that people have is the fear. It's the fear that will hold them back from going and getting the diagnosis, or from even investigating if it is. Because there is such fear around dementia, and in particular, I suppose most people would think of it's Alzheimer's is what they're fearing. But there are other conditions, there are other forms, and there are other reasons why we could have, as I said, it could be mimicking dementia. But if you leave your symptoms, you're going to get complications, and those complications are pretty severe. So I have listed out some of the major complications on the blog. Do check that out. Please do not leave these, do not leave it. If you think you have this condition, please go and get it diagnosed and get it treated. Your GP is your first protocol, and they will refer you on to the necessary consultants that are needed to give you a diagnosis. Now, in terms of cutting risks, the big risks are your age. It's mostly over 65s. Genetics. Not two things we can't do anything about. Age and genetic, everybody gets older. We all get older. We can't do anything about our age, about aging. Two, we can't do anything about our genetics. Our genetics are the way they are. Your genetics will just dispose you. Sorry, tongue-tied this morning. They are. It's just there. that you may get it. It doesn't mean that you will get it. Okay, that's all that genetics mean. It just means you know, there's a possibility that you can get it because your dad or your mum. And the more, if it was your grandmother on one side of your family, that's diluted down. By the time the genetics get to you, remember, you have a lot of genes coming into you from different parts of the family, and that could be, you know, watered down, if you like. It doesn't mean you're going to get it. Your lifestyle and health choices are the ones that you can cut the risk on. So if you know that there is a family history of dementia or forms of dementia in your family, there are ways in which you can cut your risk. And I've listed them out on the blog. The first one I will always say to people, and I harp on about it, is basic self-care. If you are not looking after yourself, that's your foundation for your life. If you're not looking after yourself, everything else goes. If you're not setting your boundaries, and we'll talk about boundaries in a second, but if we're not doing that, if we're not looking after ourselves, then of course you're setting yourself up for all sorts of things, not just dementia, but for all sorts of conditions you're setting yourself up for. Sleep is highly important. We know that. So if that is an issue, get it treated. Ask for help. Go in there, go to your doctor. Keeping active, eating well, always important. Cutting down on your alcohol and quitting smoking, particularly as vascular dementia and Alzheimer's make up that 90%. So you've got to think, how's this going? You know, what am I doing is going to affect my choice and the possibility of getting dementia. So quitting the smoking is very, very important, and cutting back on alcohol. Getting your regular checkups, guys. I know, you know, and women will back me up on this. If you have a partner, getting them to go to a GP and getting those regular checkups, really hard. Please don't leave it. Please don't leave it. I know it's hard to go to the GP sometimes. I know we kind of put it off, and we put off getting our blood tests done, and we put off getting those regular checkups done, and we put off getting the dentist done, things like that. Please do not do that, because you're setting yourself up, not just for dementia, but for other things. And if you've got a genetic predisposition to dementia or to some form of dementia, then, you know, not getting those checkups, you're just feeding into it. You know, there is something you can do. This is something you can say, okay, I don't want to be like whoever it was in the family. You take it on, you go and you're going to do something about it. You're going to grab life by the horns and you're going to do something about it. So one of those things you can definitely do about it is get those checkups, guys. And then stress. Now, this is about your boundaries. Stress is a big factor in, you know, having a stressful lifestyle. Having a very stressful lifestyle is a big factor in how you can cut your risk. Reduce the stress, and I've talked about the stress before and how you can reduce it, and that is so important. I can't emphasize that enough, guys. Cutting your stress levels is very, very important here, and it is never ever too late. Stress can have such a massive impact on our physical as well as our mental health. So, you know, cutting those stress levels, and if you check out the blog, the video is there to on www.DBpsychology. So if you go up and you put in stress into my search, the search box on my website, you will find a blog on stress management and how to reduce your stress levels, and I have done a video on that as well. So do check that out, please. That is very, very important if you want to cut your risks here, particularly around dementia. Now, the most important part, this whole thing, is people have to start treating their mental health exactly the same as we treat our physical health. So we must, if we have a problem, get it treated early. You wouldn't leave a broken leg. You wouldn't leave a broken arm. You wouldn't leave, you know, whatever. You wouldn't leave yourself in pain and agony. And if you are not treating your mental health with as much respect as you do your physical health, then you're not cutting your risks. You're not cutting your risks here. Think about it. Really do give it a big think about what you want, what your choices are, what you want to happen in retirement, basically, how you want to live your life. And I've spoken about retirement before. How you want to live your life is going to be, making the choices now as a younger person is going to have that impact as we get older. And the last point is always keep active, keep the mind active, not just the physical body active, but to keep the mind active is very important. And keeping the mind active isn't just about reading or listening to music or, the problem solving. I know they push Sudoku, and I know they push other problem solving, crossword puzzles and things like that. Just as important is interaction. Interacting, physically interacting, not interacting on social media, not just making that phone call, but physically contact with another human being is very, 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 very important to cutting your risks for dementia. You need that. We are social beings. We need that physical interaction. So, something to think about that. Being mentally active and having that social interaction is one of the biggest factors, as well as reducing your stress, in cutting your risks. Because we know that the social interaction in particular will decrease and in fact slow down the progress of the disease. So I will leave it there, and thank you all for listening. Again, I'm very sorry for the start. Facebook and Instagram are not working on my usual the usual mode that I would do a Facebook Live on. So I've tried a new technology this morning. And hello to Deirdre, Colette, as always tuning in live, and Kim as well, always tuning in every week regularly. And to everybody else, thank you very much. And you can check out this week's blog at www.deborahbyrnepsychologyservices.com. And I will see you all again next Saturday morning. And I leave it there.